We've reported the Delta variant of COVID-19 has affected children, but another group also seeing the effects: pregnant women. Kayla Solomon spoke to one mom and Central Georgia doctors to find out how not being vaccinated can impact your pregnancy.
I just felt really like my chest was really heavy. It was kind of hard for me to breathe. So I called my doctor and she told me to come into the hospital immediately.
Janae Adams says the last month of her pregnancy was difficult. The new mom tested positive for COVID-19 just 3 weeks away from her due date. Because of her symptoms, doctors had to induce her labor as she delivered baby Leilani early. Adams says she decided during her pregnancy not to get vaccinated.
I just didn't feel comfortable getting vaccinated while pregnant just because it was new. I didn't really have anybody else who was pregnant and vaccinated at the same time. So I just figured it'd be safer just for the baby to get vaccinated after the fact.
Doctors say they're seeing the same hesitancy in their offices and in hospitals. Dr. Champa Woodham, director of maternal fetal medicine at Atrium Health Navicent, says most of the patients she's seen are both unvaccinated and testing positive for coronavirus.
I really have seen an uptick more so with the Delta variant than with the original variant, and these moms are a lot sicker. This particular strain is a lot more contagious, and the viral load is a heavier burden on the body.
Woodham says they've gone from having a couple positive cases per week to having that same number every 2 days or so.
Unfortunately, we're having to make some really tough decisions to deliver these women early in order to give the mother a better chance of actually making it through their infection.
Dr. Mitch Rodriguez, medical director of the neonatal intensive care unit at Atrium Health Navicent, says the vaccine is crucial to keeping a mom and her baby safe.
If you are COVID positive, we're going to see a 30% increase in prematurity rate as a result of that. And B, if you're symptomatic, the likelihood of delivering prematurely is about 3 times higher based on the data that's out there at this point in time.
Across town, Dr. Eric Roddenberry, an OBGYN specialist who works closely with Piedmont-Macon Medical Center, says he advises his patients to get vaccinated, whether they're pregnant or trying to have children.
Because the way to protect yourself the best is to be protected from becoming ill before the pregnancy and then all during your pregnancy.
He says the toughest part is watching patients he's grown to know and care for end up suffering.
Yeah, we've within our practice had patients that have gone from being happy and healthy and in their 20s to being in the ICU and within a matter of a week or two, and it's a difficult thing to watch.
Piedmont-Macon Medical Center says they went from averaging 1 positive COVID-19 pregnant patient a month to averaging 1 a week. They say the last few have required extra care, which includes hooking the patient up to a ventilator. Reporting in Macon, Kayla Solomon, 13 WMAZ News.
According to the CDC, pregnant and recently pregnant women are more likely to get severely ill from COVID-19 compared to people who are not pregnant. And it adds about 23% of pregnant women in the country are vaccinated.